Crisis on campus. Are study drugs turning students into addicts?
ADHD meds got me wired.
Wait, you just say ADLINA is legal meds?
I get it, the name sounds scary, but these meds are not the monsters social media makes them out to be. Let's break the myth and talk science.
ADHD stimulants, Lifeline or Liability, navigating the tightrope of treatment. A guide to harness the therapeutic benefits of stimulant medications while mitigating their potential for misuse and dependence. Attention Deficit Hyperactivity Disorder, ADHD, is a neurodevelopmental disorder characterized by persistent inattention, hyperactivity, and impulsivity. It affects individuals across the lifespan, often first identified in childhood, but continues into adolescence and adulthood. Let's talk about our key medications, methylphenidate and amphetamines.
This is my medications.
You are taking this?
Yes.
You know, I heard things like it's just a bottle meth and it will get you like addicted and stuff.
Oh, I thought it was the medicine.
Same class doesn't mean same drug. Jalapeno and bell peppers are both peppers, but try biting into both and tell me, do you think they are the same?
For people with ADHD, the brain's prefrontal cortex, where focus, planning, and control happen, has low dopamine. That's like trying to tag with 1% battery.
ADHD stimulants works by increasing dopamine and norepinephrine in the prefrontal cortex, thus improving focus, impulsive control, and executive function.
Short or long acting? It depends on your lifestyle, schedule, and what you need. Short-acting stimulants usually begin working within 30 to 45 minutes, and their effect lasts about 3 to 4 hours. Examples are ADIRAH and REENITA.
Long-acting stimulants can last 8 to 12 hours, sometimes even up to 16 hours, and are taken once a day. Examples are Vyvanse and Concerta. Long-acting stimulants are usually the best choice for ADHD patients.
Why am I answering questions in Morse code?
So, is it even safe? I have heard many scary stuff like heart risk and eye problems.
Totally valid question. Stimulant meds can have side effects, but doctors don't just hand them out like candy. Before prescribing, physicians will screen for cardiovascular issues like arrhythmias or hypertension, anything that could increase risk. They also ask about glaucoma, tics, and even anxiety disorders. It's not a casual decision, it's a medical one. Safe use starts with smart screening.
This isn't a magic pill. It's just like a support beam. It helps me to do the things that I actually want to do.
Taking into account both efficacy and safety, evidence from meta-analysis supports methylphenidate in children and adolescents and amphetamine in adults as preferred first-choice medication for short-term treatment of ADHD. Though efficacy varies based on the age group and rated type, all medications except modafinil in adults were better than placebo in short-term treatment.
70 to 80% of children with ADHD respond well to stimulants, and many patients who don't respond to one stimulant may respond to another by switching stimulants. This enhances academic or work performance and social functioning. It also may normalize PFC connectivity in ADHD brains after long-term use. This adaptation is known as neuroplasticity.
What treatment has 70 to 80% success rate for improving ADHD symptoms? Is it A. Essential oils, B. Rewatching the same 10-second TikTok, or C. FDA-approved stimulants? So, what is the answer for these questions?
Correct! Control meds did irresponsible and improve focus, impulse control, and hyperactivity in a huge number of patients.
Medications are part of the puzzle. These healthy habits are your power-ups. Set routines, limit distractions, therapy boosts, minimize screen overload. It's not a fix-all, but it can be a bridge from frustration to function. People say ADHD meds are just legal meds. Now, let's break that down.
Stimulants like methylphenidate and amphetamine are the mainstay treatment for ADHD. They increase dopamine levels in mesolimbic reward pathway, the same brain circuit which involved in pleasure, reward, and addiction. This mechanism is overlapping with many other addictive substances like nicotine and cocaine.
ADHD medications, when taken as prescribed, have slower onset and more controllable release, whereas cocaine and nicotine cause rapid and substantial increase in dopamine, leading to a higher risk of addiction. Misuse of ADHD medication, such as taking higher doses or using them without prescription, can mimic a rapid dopamine spikes seen with addictive drugs, increasing the risk of dependence.
Meth hijacks your system. Prescription stimulants support a system that's already struggling.
Partnerships, and I just really want to help with these issues.
Okay, but college kids use this stuff to cram all the time. Aren't people selling it like candy?
Sure, but people also reselling Tylenols. Aren't that make Tylenols dangerous?
The truth, studies suggest that ADHD medications reduce risk of drug abuse for people with ADHD. The danger is not the medication, it's untreated ADHD.
The medication themselves are not the enemy. It is when they are misused or prescribed without care. That's why education and responsible treatment are so important.
I've heard so many stories about ADHD meds. Aren't they super addictive? Like if you start taking ADLINA, you'll get addicted to it, right?
That's a really common fear, but here's the truth. When taken with a suitable prescription and under medical supervision, the risk of addiction is actually quite low.
The clinical reality is, stimulants are first line for ADHD, but with careful stewardship. Addiction and misuse does happen. However, with proper monitoring and accurate diagnosis, this isn't nearly as likely as people may believe.
Public misconceptions happen because of overblown fears. Media often exaggerates risks, deterring patients from effective treatment. Some patients might find coping strategies that work just fine for them, and they think they don't really need it. However, when these medications are used appropriately under a doctor's supervision, the risk of addiction is very low. Research even shows that treating ADHD with stimulants can lower the risk of substance use disorders. People have a right to choose not to medicate, but no one should be kept from taking ADHD medication just because addiction is a possibility.
The underestimated danger is ignoring misuse potential that can harm vulnerable individuals. Individuals with history of substance use disorders or those with certain mental health conditions are at an increased risk for misuse and its associated complications. Continued misuse can lead to neuropsychology impairment, mental health issues, and physical health decline, affecting various aspects of life.
So, it's not about the fear, it's about the facts.
Exactly. Stimulants are not the shortcut. They are tools. And smart decisions come from understanding, not panic.
Stop the stigma. Start the conversation.
Educate yourself.
Talk to a doctor.
Share this video.
Help someone to get the support they need.
Scan the QR code to learn more.
그대는 선물입니다. 하늘이 내려준 홀로선 세상 속에 그댈 지켜줄게요. 어느 날 문득 소나기처럼 내린 그대지만 오늘도 불러봅니다. 내겐 소중한 사람. 떨어지는 빗물이 어느새 날